The American College of Medical Genetics is very happy to provide Genetics in Your Health, a series of short videos to explain to you how genes translate into health. For more information on Genetics in Your Health, please visit the American College of Medical Genetics website at www.acmg.net. Welcome to Genetics in Your Health. The American College of Medical Genetics is pleased to provide this series of patient videos on genetics in your health. If you'd like more information on how genes affect your health, please visit our website at www.acmg.net. Today we're here with Dr. Michael Watson, Executive Director of the American College of Medical Genetics. Welcome, Dr. Watson.
Thank you.
One of the things we hear about is the regulation of genetic tests, and genetic testing is changing. Can we start with just talking about how are genetic tests currently regulated?
It's much like any other area of medicine. Most areas of medicine are regulated through the laboratory component, and that puts genetic testing into the regulatory sort of loop of things. There's two ways by which it's regulated. The first is really when a product is made by a company that can be used in testing. The FDA is often involved in the oversight and regulation of that whole line of products. And then there's another component that is called the Clinical Laboratory Improvement Amendments that regulate the practice of laboratory medicine and deal with issues of personnel and quality assurance and other aspects of the way a laboratory delivers a test to the public. And then I suppose if you step back from that and then think about what a genetic test really is, it's two pieces. There's an analytical component that is what we use those devices for or build a test around. And then there's the piece about how one interprets the results of the genetic test. And it's, I think as time progresses, we'll see that the analytical methodologies of genetic testing will get easier and easier, much like other areas of chemistry and testing where you get back a result and the answer is obvious. Only in genetic testing the answer will not be obvious. There's a tremendous amount of variation in the human population, lots of genome changes that are very poorly understood and often do rise to the level of the practice of medicine in order to interpret the result of the test. Some things are very stable and well understood, but others can be very complex.
Do all organizations believe that the current regulatory oversight is adequate?
I don't think everybody agrees with that it is adequate right now, and it's really because genetics is evolving very rapidly. And if you think about sort of the three major paradigms of genetics, there are the rare diseases where the genetic factors are very strong, and those become valid very rapidly and introduced into genetic testing very quickly. Then you have another group of tests that are sort of high susceptibility tests, things like the BRCA genes in breast cancer, colon cancer, some of those where if you have the particular mutations, you may have a 50% risk of developing the disease, but there are significant environmental components that contribute to your chance of developing those diseases. And then you have this next new area, which is really the common diseases and the genes and other factors that may increase your likelihood of having type 2 diabetes or some of these more common diseases. And those are really the ones where we don't have much evidence in place. And they're offered over the internet and other ways that are outside of the traditional healthcare system. And I think those are the ones that are really leading people to argue that we need a higher level of regulation of genetic testing. I'm not overly concerned about those things that have been part of genetic testing for many decades now. We've been doing genetic testing since the early mid-1960s. But this whole new wave of things for which many, many genes may ultimately come together to give you a risk is a much more difficult area of genetic testing.
Given that the field is changing at really a very rapid pace, what does the college believe are some of the changes that might need to take place to continue to ensure the safety of genetic testing?
I think there's a couple of areas, obviously, that you would want to pay close attention to. Much of what we know about genetics has developed over the last 15 years or so. In the mid-1990s, there was not much education in medical schools relative to medical genetics. So many, many physicians who are out in practice now have never been exposed to the newest wave of genetics and what it's doing to the healthcare system and the new genetic tests that result from the information out of the Human Genome Project. So clearly education is a huge piece because if you don't know when a genetic issue is important in a family, you don't ask for the test, and a family is really then deprived of the potential value that the genetic test might have brought to them. So education is probably one of the first. Regulation has its place, and there are currently regulatory systems within genetics, but there are a huge, we test now in over 1,500 genes. And there are many, many rare diseases for which any individual regulatory assessment is very hard, because I think there is a general understanding that when things are rare, you have to accept the sort of weak statistical power that we get from our knowledge of those diseases, and it's very different than what you would want to do to everybody in the population, vaccinations and those kinds of things, where you need very, very strong medical information before you decide to do something of that kind to patients.
Does the college generally recommend, if someone is thinking about undergoing some genetic testing, to have a healthcare professional involved?
Oh yeah, we think certainly that area of education, both in the public and in the general non-genetics provider community, is such that it's important to have an informed person sort of between the patient and these tests. A lot of decisions have to be made about whether a test is appropriate or not for an individual. There's often features of a family or of a patient that change the way you interpret the result of the test. All of those, I think, argue right now that we should have educated, trained people in between patients and these tests. And it gets more and more important as you move to the test that we are concerned about the validity.
Thank you very much, Dr. Watson, for taking the time with us today on genetics and your health.
All right. Thank you, Kathy.
Thank you for watching our segment on genetics and your health. For more information on genetics and your health, please visit the American College of Medical Genetics website at www.acmg.net.
Thank you.